So 2 years ago, we started a cardiac rehab program called Heartways. We anticipated the hospital's issues with readmissions and fines, and cardiac rehab seemed to be one of the biggest areas of need in our area. So we, with a cardiologist, started this program. We have employed a cardiac nurse practitioner, full-time on staff, who sees every admission for cardiac issues, even evaluates new admissions if there might be a secondary cardiac issue that we should be aware of. The presence of the nurse practitioner has made a huge difference in our readmissions. Our readmissions dropped considerably. Our length of stay also has dropped considerably. And so we've been just really excited about the work that's being done. We are to the point now where Columbia Presbyterian is now sending us heart transplants and open heart surgery. All of our staff are continually being trained. We've had to double our staff, actually. Evening shift now runs the same staffing levels as the day shift. And so there's, a lot has been, we've made a huge investment. We're working very closely with our local hospital as well in the cardiac program. They're very pleased with the work that's being done. So, yeah, that's kind of what we're doing.
And are you considering expansion?
Well, in expansion to the extent that we have assisted living. And we are also finding that for some of our cardiac rehab patients, assisted living is another good step for transitioning before they go home. And so we're looking at that. At the moment, payer mix and so on, source of payment, that's going to be. But we believe that as managed care and capitated rates begin to control our payment methodology, that the assisted living will be another opportunity. But what we're finding is that it's when they go home where the greatest risk is for readmissions to the hospital. And so we have a nurse who does nothing but educate upon discharge. So we have a cardiac RN who, upon discharge, sits down with the family, sits down with the patient, and talks about what's next. What will they need when they go home? The importance of the medications they're on, the importance of their diet. And so what we're trying to do is provide an educational piece prior to going home to, again, eliminate readmissions. And then once home, we have follow-up calls from that discharge nurse. Hi, how are you doing? Is everything okay? Any other questions? I mean, all of us, when we go to a doctor's office or anytime we get directions or instructions, they kind of, some of it sticks with you,
right.
But there's always a piece that there's so much going on.
Right. And
so that's making a big difference as well, and developing that relationship with the family for any future needs with our healthcare programs.
Right.